Rural health to me means taking care of our population in areas where we do not have the same resources that we do in large cities.
Ontario is located in what we call the Treasure Valley, which incorporates not only eastern Oregon but also western Idaho. We are near Frontier State, which means it does not have a tremendous amount of resources, and there's a lot of distance between those resources.
Malheur County is one of the poorest counties in the state of Oregon, and we have a huge need, and it's difficult sometimes to get services for kids.
Dr. Dombrowski is in a class by herself, for sure. She never falters when it comes to patient care.
I was an RN before I became a doctor, and it was very apparent to me as an RN that there was a great need for children's health in this community, and my goal was to come back and become a pediatrician and hopefully make a difference in the community.
She's very committed to the families here and our community and making it a better place. I think that's what really makes her very special.
I love knowing my families. I love being able to see them, talk to them in the grocery stores, just being a part of their life outside of medicine. You get to know the whole family, and you get to know the child as a whole individual.
Sandy walks around the halls. Everywhere you see her, she's smiling. You would never know if she had a bad day.
I tend to get involved, and I was attending actually a meeting for the American Academy of Pediatrics conference on children with special health care needs, and 9/11 happened, and it was very devastating, and all I could think about was trying to get back home to make sure everybody was safe, and is there anything I could do in New York, and what could I do? Since then I have gone to many disasters, Hurricane Ivan, Hurricane Katrina. I was at Hurricane Rita. I went to American Samoa for the tsunami there, Hurricane Gustav, and I continue to go back to Haiti to work at a primary care clinic there, taking care of people in a little village called Leon.
When we deploy, we get notifications. Sometimes it's 24 hours, it can be 12 hours, and we do hit the ground running. We have to assign jobs. I mean, it's mass chaos, but it's organized chaos.
When you go to a disaster, these are people who oftentimes have lost their homes, they've lost everything they have, they've lost loved ones. Many of them have significant injuries. People's resilience is just unbelievable, and I just feel very good that I can help. The stories they tell you give you hope in humanity. That little plaque up there is probably the one that means the most to me. 100 years from now, it will not matter what my bank account was, what the sort of house I lived in, or the kind of car I drove, but that the world may be different because I was important in the life of a child. That means the most to me. The awards are nice. I mean, it's nice to be recognized, but I don't see myself as a hero. I don't see myself as any different than other people. I'm just a little busier.
There are only a few pediatricians here in the area, and our area, I mean, is gigantic when you think about it. I mean, we take in patients that are, 70 miles away, so I think she has a huge load on her shoulders out here.
She's been able to create a medical home from nothing to being one of the most successful medical homes around.
My goal is that when I'm done, that I have contributed something to make Ontario a better place.